Ultrasound imaging is a widely accepted diagnostic tool. Now, this energy source is being investigated as a therapeutic tool as well. Focused ultrasound delivers thermal energy with ultrasound waves focused on a single point. A high-intensity ultrasonic beam, called sonication, passes through soft tissue and focuses on a targeted location, causing localized high temperatures of 65 to 85 degrees Celsius without affecting surrounding tissue. This demonstration on a phantom gel shows how focused ultrasound energy affects one focal point, while the rest of the matter is not affected. This results in areas of protein denaturation, irreversible cell damage, and thermocoagulative necrosis with a sharp delineation between them. What does MR guidance provide? Magnetic resonance measures thermal changes in the tissue. Every 3 seconds during the sonication, thermal MR images display the temperature buildup in the targeted spot, ensuring that it reaches coagulation temperatures. This real-time thermal feedback helps the physician control the treatment. MR's high-quality cross-sectional anatomic resolution enables exact targeting of tumors and visualization in 3 dimensions. T2 weighted MR scans show the pelvic anatomy in excellent detail by slice. This sagittal image shows the spine, uterus, and uterine fibroids. This slice of a different depth shows the endometrium in green and the other anatomical structures. The axial orientation shows the uterus, uterine fibroid, bowels, sacral nerves, and pelvis. In this slice at a different depth, you see the uterus, uterine fibroid, endometrium, and pelvis. The coronal view shows these organs from a third orientation. The next slice shows the same anatomy at a different depth. This visualization enables the physician to clearly identify the anatomy and treatment target for safe and effective treatment. Exablate 2000 consists of 3 components: a console which sits alongside the GE MR console, an electronics cabinet which resides in the MR equipment room, and a detachable patient table with a movable transducer. The ultrasonic transducer is immersed in a sealed water bath with a positioning system which moves back and forth and rolls and tilts. The transducer generates the beam of focused energy which passes through the water bath and acoustic coupling gel pad to reach the targeted tissue without affecting the surrounding organs. The depth of focus in the body is controlled electronically. The patient table is docked to the MR system, and treatments take place within the MRI scanner with the patient lying prone on the patient table. The patient is prepared with an IV catheter to deliver medications and MR contrast, and has a Foley catheter to keep her bladder empty during the procedure. The treatment planning and the entire procedure are conducted from the Exablate console. Images of the pelvic area are acquired by the MR scanner and retrieved by the Exablate system. From this point on, the Exablate system interfaces with the MRI, and all operations are performed from the Exablate console. 2 rows of scans are displayed in strips of images along the top of the console screen, displaying slices of 2 orientations: axial, coronal, or sagittal. The physician selects the treatment area and draws it on the coronal scan. This is confirmed in the other orientations. The targeted energy beam path is checked to determine that nothing interferes with the energy beam in any plane. If so, the pitch and roll functions can be used to change the angle of the beam or change the near or far field beam path to avoid bowels, surgical clips, scars, nerves, or any hard implant. The distance from the treatment region to the sacral bone is checked to ensure that it is greater than 4 centimeters in the far field. Fiducial markers are added to indicate major points of anatomic reference as a safety measure to identify patient movement. Based on the tumor volume and depth of the prescribed treatment volume, the system computes the power, number, and size of spots appropriate for the treatment. The spot is cylindrical in shape and can vary from a few millimeters to 10 millimeters in diameter and 30 millimeters high. At any point, the physician can add, delete, or move spots, change the spot size, or the sonication angle, or modify other parameters to optimize the treatment. Thermal imaging is used to verify system calibration and dose suitability. First, a low dose of energy, too low for necrosis, is used to identify the actual point of energy delivery and adjust small beam deflections caused by patient-specific tissue deviations. Next, a full dose of energy is used to verify that the planned dose reaches 65 to 85 degrees needed for thermal ablation. This confirms that the energy selected is not too hot or too cold. If so, adjustments are made. At any time, parameters can be altered to obtain the desired result. Exablate treatment consists of multiple sonications delivered in a planned grid until the entire tissue volume is treated. Each sonication lasts about 20 seconds, with a cool-down time of about 90 seconds. When the sonicate button is pressed, the MR begins scanning. Energy delivery begins, and thermal images are displayed showing the temperature buildup. The physician knows immediately if the focused ultrasound energy has reached the planned spot and temperature. After each sonication, the ablated area is displayed in blue as accumulated dose. The tissue temperature in the focal volume reaches 65 degrees, but because the temperature fall-off is sharp, the temperature of surrounding tissue is not raised. 4 millimeters from the spot, the temperature is normal body temperature. The patient receives only limited conscious sedation and provides feedback throughout the procedure. At any point, she can press the handheld Stop Sonication button to immediately stop treatment. Based on the real-time feedback after each sonication, the treatment plan can be modified by adding or deleting spots or changing other parameters to minimize patient risk or to optimize treatment. For example, if the thermal mapping indicates that the temperature after this sonication was too low, the energy can be increased. After the next sonication, the thermal map displays the higher temperature. In this example, a sensitive structure was observed in the near or far field, so the transducer for that sonication is tilted. Sonications are repeated until the planned tumor volume has been ablated. The accumulated dose map displays all the areas that were necrosed. Contrast-enhancing agents distinguish uterine fibroids from healthy tissue. These post-treatment contrast-enhanced MR images enable the physician to verify the immediate treatment effects by depicting the coagulated region caused by the ablation process. The ablated tissue is slowly resorbed by the body. This is an example of an accumulated dose map and the non-perfused volume at the end of a treatment. Post-treatment, the MR room can be switched from exablate mode to diagnostics mode within 10 minutes. The patient is observed for 2 to 3 hours while recovering from sedation and is then released home. Most patients do not require prescription medication for pain and resume their normal activities in 1 to 3 days. The combination of focused ultrasound and magnetic resonance guidance using Exablate 2000 provides MR visualization of anatomy and energy beam path for careful targeting, real-time thermometry for monitoring and control, and closed-loop feedback, all to help ensure safety and efficacy of the treatment.